it's lovely to be here with everyone in 3 dimensions. I'm going to talk about the policy agenda, which really sets the scene for why we're all here today and for all of the work that is going to follow today. So the Victorian Cancer Plan is the main document that we have in Victoria. It is a 4-year rolling plan that is from the Improving Cancer Outcomes Act, and it sets the government policy and the reform agenda for cancer. There are 5 core principles in the document, and 3 of them in particular are relevant to today. All of the principles are about ensuring that Victorians have the best cancer outcomes and experiences for their care. So the 3 in particular for today is that the care delivered is person-centred, and that everyone using Victoria's health system has equity in access and what happens, the outcomes. Having safe and quality care, and that the care delivered is informed by evidence, so that as the evidence changes, so does the care. So the Victorian Cancer Plan is a series of rolling cancer plans, so they're 4 years long. It essentially retains the one that we have now. We're halfway through, and it retains the structure of the prior one with 5 action areas. What's new about the plan compared to the last one is that there are additional short and medium-term goals. I'm not going to run through them all today, but you'll get a graphic a bit later. And the other thing that's important, and you'll notice it on some of the presentations later today, is that the optimal care pathways will be mentioned a number of times, and that the optimal care pathways are actually embedded into the Victorian Cancer Plan and into the action areas. So the optimal care pathways, they are frameworks, and they consist of 3 documents in a suite. So there's the main document, there is the quick reference guide, which is the Ready Reckoner, it's about 4 pages long roughly, and then there are the consumer guides that are called Guides to Best Cancer Care. The optimal care pathways have a number of key principles at particular steps. The pathways themselves reflect the evidence, so they reflect the emerging evidence also. So it identifies optimal supportive care and the timeframes. These are things that have been updated in the current versions. These optimal care pathways are for everyone in the system, not just health professionals, but for consumers also. These are now nationally recognised and accepted documents. They've been endorsed nationally, including some peak cancer control agencies. They were developed with experts. There are multidisciplinary groups involved in writing them, and the original 18 have recently been updated and are on edition 2, and there will be a number of people here that were involved in that, and so thank you very much. The optimal care pathways are kept refreshed. I would like to say that there are a number of new ones coming out. Some recent haematological ones went up on the Cancer Council Victoria website, but there are some new ones coming as well, neuroendocrine cancer and the adolescents and young adults, which is a population-based one. And there's some more also being developed for haematology. To make it easy for you to access these wherever, if you want to know what the key measurement steps, timelines to particular parts of care, we have developed the Progressive web app. It looks like it's a bit covered on the screen, but it's optimalcarepathways.com.au. On your phone, you can access them. Just a very quick mention on what pathways are and what they are not. This is a slide borrowed from Professor Bob Thomas, where he goes through what they are. The main thing is the point in bold, which is that pathways are about organisation, process, policy development, and the creation of a framework of care. They are not clinical guidelines. They are a complementary document to clinical guidelines. This slide is just really represents the different stakeholders. A number of you mentioned there. The tumour summits are health services, integrated cancer services, consumers. It talks about the stakeholders and it talks about some of the resources that are there. So, for example, the primary health pathways are where we've put the optimal care pathways on platform so that they're accessible in primary care. A feature of all of the reform agenda for the optimal care pathways is the importance of measuring the system against them. So the rolling program of tumour summits, there's been more than a dozen now, and Paul mentioned the history of these. A number of them are repeated. They started in 2014, and with each tumour summit, they're refined each time. The work starts at this summit, actually it starts before, and this summit is where some of the priorities are determined, and there is collective discussion and a focus on what is achievable and meaningful for statewide improvement. And the intent is that then the data is reviewed at a later date. There are repeat tumour summits, but even within the quality improvement work, post a summit that's held in health services, there's the plan, do, study, act cycle, which is plan for what you're going to do, measure it, see if you've made a difference, repeat the cycle. So these are the pink things that you can see on here are the short, the medium and the long-term goals in the Victorian Cancer Plan. To meet these goals, it does require a sustained and coordinated effort across the sector. The tumour summits are a contribution to that. And so as you think and talk about melanoma today, could you please keep in mind what would make a difference, including the scale of change that would be needed? That you need to be able to measure and monitor the progress? And what will you do after today to support the priorities that are talked about today? And finally, I would like to acknowledge the considerable amount of effort that's been put towards these already, and the effort that'll be given today and then post the summit. A number of key people. Thank you very much to the two co-chairs, Associate Professor Phil Parente and Victoria Ma. The Victorian Integrated Cancer Services, there's a number of people at the Department of Health that have support these, in particular the data function, since these are very data-driven affairs, and of course Cancer Council Victoria, who do a number of things as part of the cancer sector. So I hope you enjoy the day, and I'm looking forward to being part of the discussions here.